Welcome to Sensible Health Solutions, the show where we simplify health and wellness. Join your hosts, Hallie Fields and Dr. Scott Luper, as they share practical tips and expert insight to help you navigate common ailments, nutrition, and overall well-being. Tune in for straightforward advice that empowers you to live a healthier life.
Hello, Dr. Luper. How are you?
Hello, Haley. I'm doing great. How are you doing?
Good. I'm doing great. Thanks for asking. I was curious. We work a lot with herbs in the clinic, and I'm wondering how you formulate these herbal antibiotic tinctures.
First, let me back up and say herbs can be used as antibiotics.
Yes.
Except for they're not as strong as regular antibiotics. And that is both a weakness and a strength. It makes it better for people and it makes it worse for people depending on what the situation is.
Why would it make it better for people for them not to be as strong?
Because we don't want to eradicate bacteria from the human body. We want to leave bacteria there. We want to kill the bad guys and leave the good guys. We need our bacteria. For us to be healthy, we have to have bacteria. If we were to send people to space, to live in space, you would have to send the bacteria with them.
Right.
You know, you think, whoa, we have a fabulous opportunity to finally get rid of bacterial illness and eradicate bacteria from the human body. We sterilize people inside and out, put them in space capsules, send them to space. They're never going to get another cold again the rest of their life. It'll be fabulous. No, they will die.
Because they have to have a little bit of the bad bacteria to cohabitate with the good bacteria, to make the good bacteria flourish?
We need the good bacteria for our bodies to function correctly. We need the bacteria. Otherwise, our bodies don't work right.
Right.
We're evolved to coexist with bacteria. Without them, we cannot be healthy. We cannot live well. We need to not think about bacteria as the enemy, but bacteria as our friends. Think about this.
In a balanced way.
Plants. There are weeds and there are food, right? So there's the good guys and there's the bad guys.
Yeah.
So we don't want to eradicate plants from the planet Earth.
No.
Finally, we'll be done with weeds.
We're getting rid of all the plants.
No, we want to keep some because they're helpful with
Yeah,
us.
but they also help to pollinate the good plants.
We want to think about organisms in the way that a gardener thinks about plants.
Sure.
We want to be stewards of our bacteria.
Okay.
We want to encourage our bacteria. We want to get them healthier than they would be otherwise. Not just avoid killing them with antibiotics.
By feeding them nutrient-dense foods and creating an environment in which they can flourish.
Yep, just like that. So both inside and out.
Okay, and what are some of the ways...
So did I answer your question?
I think you did, for both good and bad.
Yeah, so it turns out the herbs are a way to knock the bad bacteria down without eradicating the good bacteria. So the side effects of herbs are less. Now, there are situations where your life is on the line and you got a bacteria that is just short of killing you. And those people need hardcore antibiotics.
Right, you have a septic infection.
Yep.
That needs...
Perfect example. We had somebody come up a few months ago with a septic infection. It came in a wheelchair. I checked them out and sent them immediately to the hospital. And it saved their lives.
Yep.
They went to the hospital, they got IV antibiotics. It was a life-saving situation. Got another patient who got a gallbladder infection. That was a kidney infection. We got another patient with a gallbladder infection. Same story, sent him to the hospital. The hospital gave him IV antibiotics and saved his life without question. But those patients are less common. More commonly, we get people with like sinusitis or gut infections or earaches or things like that. So the kind of smaller infections. Vaginitis is another one. And what we want to do is we want to treat them in such a way that we make life hard on the bad bacteria so that our body can kill it, slow it down, so that we can get ahead of it without eradicating everything in their bodies. Right? So how do we do that? We need either a mild antibiotic, and they do exist, there's our mild antibiotics, or we do herbs. And I like herbs.
Yeah.
I like the effect of herbs. I like what we get from herbs. I think how the herbs work is builds us up, and it's less likely to fail if you can get the right combination of herbs that fit the right situation.
And they have greater effect on so many different things rather than just one thing.
Yep, that's exactly right. So you think about what an antibiotic is. And antibiotics, a lot of times they come from organisms or plants or herbs or things like that. And it's one thing that breaks something in a cell, that prevents that cell from making its cell wall, for example, or making dividing the cell being able to divide. Some mechanism that it needs in order to take over our bodies is poisoned by the antibiotic. So it's very specific. So there's one thing that antibiotic does. So eventually, out of the millions of bugs that are dealing with the antibiotic, one of them, just due to random chance, luckily comes up with a workaround. And so now I'll give an example. Now the cell wall builder, it doesn't block it anymore. They figured out how to work around it. Now they have antibiotic resistance. Mm-hmm. And this is the bane of our modern medicine, because the organisms are winning the race of coming up with workarounds, and we can't find enough antibiotics in nature to exceed the rate that the bugs are getting the workarounds.
Yeah.
Now we're in this in some ways fabulous little bubble of the antibiotics are new enough that the organisms haven't figured out how to block them all.
Right, how to evolve past.
And so you can see, if you get a bad infection, I can still send patients to the hospital with a pretty good chance that they're going to get saved by IV antibiotics. Mm-hmm. Now, 50 years from now, that will not be the case. Basically, they'll quit working, because all the bugs will have developed a resistance to the stuff we have. Mm-hmm. I don't know if it's going to be 50 years, it's going to be 30 years, it's going to be 60 years, I don't know. Some small amount of years, maybe less than that.
Yeah.
And in some cases, people are dying because they've already got to that point.
Right.
Where they can't survive the infection based on the fact that no antibiotic will work.
Right.
Now, the thing about herbs that's different is herbs are not one thing. Herbs are 100 things. Mm-hmm. Because they're plants, and there's lots of constituents in the plants. The plant's not made up of one molecule.
They have multiple
of
compounds.
Thousands of molecules, hundreds of different compounds. Mm-hmm. And many of those are effective in one way or another at slowing the bacteria down, because these plants in nature have to slow the bacteria down. So the reason why we can take these plants and have them work is because bacteria try to kill the plants. Mm-hmm. And the plants came up with a chemical that makes them resistant to the bacteria, or whatever it is. And so we can use that. We can collect the plants, concentrate them down, have people take them. And again, it's not one thing that the plant does. It's a multitude of things the plant does to help slow down the infection. And since there's so many things, the organisms can't create resistance to everything. They may be able to come up with a resistance to one thing or two things or three things, but not 50 things.
Sure.
And so there you go. The plants continue to work.
So what are some of your favorite antibacterial herbs?
For what?
I mean, let's say common cold.
So common cold is different. Common cold is not a bacterial infection.
Okay.
That's a virus.
Okay, so there are different herbs that work for viral infections versus bacterial infections.
Well, we could talk about viruses too. So let's talk about viruses a little bit, since you opened that topic up.
There's a door.
So the thing about viruses is they're particularly difficult to kill because they're not actually alive. It's weird to think of it this way, but viruses don't have any metabolism. They don't eat, they don't poop, they don't breathe, they don't have sex, they're not really alive. They're just little packages of protein. The protein codes for making viruses. And so in order for a virus to work, it has to have a live cell that it can inject this code into and turn the cell from a
healthy
stomach
cell
or liver cell, whatever it is, into a virus factory.
Okay.
That's what they got. That's the protein, is information all coiled up. So that when the little protein packet attaches the cell, it injects that information in the cell. The information does what it's supposed to do, which is go in.
And then the cell multiplies.
And the cell makes more viruses. And then eventually the viruses build up so much that that cell pops, and thousands of viruses spread into the area, and then they attach to other cells and turn them into virus-making factories as well.
And then you're sick.
Then you're sick. Now, the reason why you're sick is not because the virus is killing your bits, it's because our immune system is set to be sensitive to this thing, where the cells start, instead of doing what normal cells do, they turn into virus-making factories. They have a suspicious look when they do that. They tend to leak proteins that are weird, and our body can pick that up and sense it and send in killer cells that are designed to pop the cell and kill it. And so that way the virus factory gets destroyed, and they destroy the virus factory. Now they also destroy the neighboring cells. The ones on either side of the virus factory, those also get wiped out. And so now, with all these chemicals being released from our immune system to kill cells and to stimulate other white blood cells to come in to kill other cells, and all of that makes us have symptoms. We get achy, we get tired, we get sniffly, we get fever. That's a classic one.
Yeah, fever.
Right, for fever, because now all the white blood cells work better, because now you just got hotter, and so they're now more active and they're more likely to kill stuff. And it can get so bad that it can become a runaway train of symptoms, and that's what killed people who had COVID.
Right.
The trick with COVID, or the problem with COVID, is that COVID caused an exaggerated immune response, and so the immune system just went off the rails and then just did everything all at once, and we can't live when everything all at once is happening. It wrecks us. And so people who had good immune system control can survive COVID, and people who have poor immune system control would just fly off, older folks.
Yeah.
And they would fall apart. And so that was the problem with that. So the thing about the virus, again, the strongest tool we have to fight viral infections is our own immune system. Mm-hmm. Our immune system is by far the best tool we have to be able to clear the viruses out. The things that people take to help that are antivirals, with rare exception, there's some things that actually get in the way of the manufacture of viruses. HIV drugs mostly do that. They poison the conversion of the cell into a factory. They literally go in and change the way the viruses are manufactured. Those are rare. Most of the so-called antivirals, really what they're there to do is they're to stimulate the immune system, to get the immune system working better.
So in contrast, the antibiotics, are they there to de-stimulate the immune system, or?
Yeah, they can stimulate the immune system also, but what they're really designed to do more is to actually gum up the works for the bacteria.
Okay.
The bacteria is in fact a living organism. It does breathe. It does eat. It does poop. It does all the things that living things do. It's absolutely alive, without a doubt. And so there's a lot of mechanisms that the cell needs in order to survive, and you can go in and you can poison those mechanisms. And plants do all the time. And animals do some, but plants are really better at this. And so we use plants more than we use animals to be able to act as an antibiotic.
So back to my original question, what are the best herbal antibiotics?
Okay, now go back to my follow-up question, which is to treat what? Because it varies on what we're treating. Let me pick one. Let's say urinary tract infection.
Yes.
Okay, so the one that I like the best is Usnea.
Okay.
It's a lichen. It's a mixture of fungus and algae. It's a trippy little plant. I'm tempted to go into what Usnea looks like and where you find it and such. Let me keep away from that. And just say Usnea. I like Usnea. And Usnea has to fight infections on its own because it's a living organism and it lives outside, and things try to get on it and eat it, and it's resistant to that. It's particularly resistant. It's been around for a very long time, millions and millions and millions of years, and it's really, really good at fighting infections in nature. And so what we do is we take it and we use it to fight infections in our bladder. The nice thing about it is the constituents that fight the infection are concentrated in our kidney. We put it in our pee, and the pee goes down and kills the infection in our bladder. And one of the reasons this came to mind because my very last patient I just saw
was a UTI patient. Yep.
So let's see, we're on urinary tract infections. Let me pick some other ones. There's one that's called Arctostaphylos uva-ursi that's particularly effective. It's bearberry. It grows in the Pacific Northwest, up at high elevations, above the tree line or in the tree line, kind of the edge of the tree line. And the plants that work the best are the ones that are stressed, that they're living in an environment that's really quite challenging, and they have to struggle, and they have to concentrate their antibacterial stuff in their system. Those are the plants you want. Plants that grow in places where it's warm and moist and things are weak and they tend not to work as well because they don't concentrate the antibacterials as well. So the Arctostaphylos, you give the stuff that grows in marginal environments. It's really not a great place for it. Tend to be the better source of the antibiotic.
When are herbs better to use than antibiotics?
When you don't want to kill everything.
Okay.
What you want to do is you want to win the fight. If you've got an infection, we want to triumph here, but we don't want to triumph to the point where we weaken the human. Mm-hmm. We want to have a human come out stronger. So if a person who gets an infection can overcome that infection, the immune system learns something. It becomes smarter.
It remembers.
It remembers, and it becomes more effective and efficient at fighting the next infection. Huh?
Can bacteria develop resistance to herbs?
It's hard. The answer is yes, but not really. Not really. It depends on the herb. Some herbs, really, it's their one main thing. It's really the reason why the herb is working. And so the bacteria can get a resistance to one main thing. Mm-hmm. But the trick of herbs is they're not one main thing. Mm-hmm. There are lots of main things.
Right.
There's a dozen main things. Mm-hmm. So now it's really hard for an organism to get resistance to that.
What if a patient were to take a tincture long term? Would they grow resistance to that certain concoction?
The answer is no. In theory, it's possible, but in actual fact, it doesn't happen.
Because each herb is made up of so many different compounds.
Yep, exactly. Now let's talk about one that's somewhat controversial, and that's echinacea. Echinacea is a super famous herbal antibiotic.
Yeah, and an immune stimulant.
Yep, and people swear by it, mm-hmm. and they also say it's useless, doesn't do anything at all. Now the thing about echinacea is really, 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 really good at blocking the uptake of viruses. Mm-hmm. So if you know there's a virus going around, and you take an echinacea tincture, you get a bottle of it, you squirt it in your mouth, the chances of you getting sick just basically goes almost to zero. But it's because you're preventing the infection. Mm. If you are already infected and you do echinacea, it hardly does anything.
Yeah.
It's a blocker.
Okay.
So you have to use it correctly. To use correctly, it's fabulous.
Yeah.
So people who like doing echinacea, everybody's sick, and I'm going to start doing echinacea so I won't get sick. It works.
I hear a lot of people doing echinacea tea.
Yep. Mm-hmm. It works. Doing it as a tea is a wonderful way to do it.
It's delicious.
So that's a great way to do it. Now the thing about echinacea, when you use it as a tincture, it's got this kind of mouth numbing effect, which is not necessarily very pleasant. Have you ever tried it?
No. Can't say I have.
You should try it. We got some right out there.
Yeah.
I can give you a squirt and blow your mind.
Get me all ready for the holidays, prepared and.
Well, I don't know. That's the right. Numb mouth is not necessarily how you want to live your life. Mm-hmm. If you're taking echinacea, you know.
Okay.
You know you are, because you get that. Now in the tea, it's weaker, mm-hmm. so you don't necessarily get that effect. Also, they tend to mix the echinacea with other herbs that make it taste better. If you make a bad tea, you can't sell it.
Yeah, of course not. They have a market full of thousands of dollars worth of echinacea tea.
Yeah, nobody wants bad tasting bitter teas. Which it's interesting because it turns out the antibiotics that are the best are in fact bitter. Everything I've mentioned has been bitter. Mm-hmm. All the herbs we're doing that I've mentioned so far. There's lots more. Let me give you another favorite. Mahonia. I love Mahonia. I use it a lot.
That's not as bitter.
Oh, yes, it is.
Is it?
Oh, you bet it is, without a doubt. It's
It
mind-blowingly bitter.
smells a little sweet.
It's not.
Okay.
Nope, not one bit. It's nasty, nasty, nasty in terms of bitter. Though it works really, really well. I like that. And it has many characteristics that are beneficial. We not only use it as an antibiotic, we also use it to balance people's blood sugars. Because Mahonia works about as well as metformin as a drug.
Yeah.
So, I mean, it's nice for blood sugars. And the effect lasts longer. Metformin, again, is one thing, it does one thing, and then your body gets a resistance to that one thing it does, whereas Mahonia is 100 things. And so it doesn't do just one thing, it does all these things, so the body has a lot harder time getting resistance to the effect of it, the beneficial effect to it. So, there's that. You got any specific infections you want to talk about?
Oh, we covered UTI. What about bronchitis?
Bronchitis is a very good question because that one can turn into pneumonia.
Yeah.
And easily get killed.
Yeah.
So what I recommend is let's slow down on this one a little bit. First of all, you got to figure out how sick you are. If you are very sick, if you have pneumonia, you need to go to the hospital. You need to go to the emergency room. You need to go to urgent care.
And you need
get
an
on antibiotics
for
because
sure.
Your chance of you dying is going up. So I'm not
Because
against
there's
antibiotics
fluid
at
building in the
all.
lungs at that point.
Completely for antibiotics. I think they're a fabulous invention. They do have side effects to them. We got to be smart about how we use them, but in the right situation, you absolutely want to have an antibiotic. But bronchitis is not necessarily that situation. A lot of times people get a cold, they get postnasal drip, it drips down in their lungs, they get a little congestion. It's not full blown, but it's going on, right? You get tracheitis, you get bronchitis. And so what you want to do is take something that'll get the mucus up and out, that'll knock the bacterial growth down, and do something that's soothing to your lungs. So Mahonia, again, is one of my favorites. And verbascum is a lovely, soothing, gentle, get your cough, loosen up your lungs so that the stuff you want to cough comes out. It's also known as mullein. That's the common name for it. Grows in the Northwest. There's another one called Tussilago. The common name is colt's foot. It's similar. I like the verbascum, works a little bit better than the colt's foot, but a lot of times I put them together. The sundew, which is an interesting plant because it's got sticky leaves that capture bugs. Sundew can be used to treat bronchitis as well. Grindelia is another one that I use to treat bronchitis. There's a bunch of them. But some combination of 4 or 5 of those together, and it works beautifully. It really does. It's fabulous. Now, there's another thing. If the infection is really bad, it is a serious infection, then there's another concoction that I came up with that works. This one, let me tell you how I came up with it and why I came up with it first. I have a few patients who have chronic obstructive pulmonary disease, COPD. And what happens with that is their lungs are actually damaged by infections, by whatever, the inflammation that's going on in the lungs. And so they're very, very, very susceptible to lung infections. And the people with COPD, at least well into their COPD, like chronic COPD, fully developed COPD, tend to get pneumonia yearly,
if
twice
not,
a year.
yeah.
Like that. So the patients we see are very prone to that. And so they get antibiotic after antibiotic after antibiotic, and there's
Which
nothing else you can
weakens
do.
their immune system further and then makes them more susceptible later on.
So what we came up with is a nebulizer treatment, where a nebulizer is a little device that'll take a liquid and turn it into an aerosol. And then you just breathe the little tube. The little thing generates the mist, and then you breathe the cool mist in. And so what we do is we take a concoction of herbs, and we just put it about 5 milliliters or 10 milliliters, which is about a teaspoon or 2, into the nebulizer, and have them breathe the fumes. And fumes is not the right word, the mist that's generated from this. And they don't get the infection. Now, you can do it to treat the infection, but I don't want to mess around with pneumonia. Pneumonia is a famous killer of people, and I'd rather just do the antibiotics and deal with the building up people's healthy bacteria again later. But what I want to do is I want to make sure these people don't get infected to begin with. So what I have them doing is breathing this little
Nebulizing
tincture daily.
Okay.
And that way they don't get sick.
Yeah.
And it works. It actually works. It's like amazing. So the folks that I've done this on, they don't get pneumonia anymore. They're just literally, pneumonia never happens anymore.
And do they do this nightly? Do they do this weekly?
Nightly.
Nightly? Okay.
So, and it's, it's easy, it's inexpensive. It doesn't kill all your bacteria off. So it leaves your normal bacteria intact. And it just makes sure that the bad bacteria can't get a foothold.
And is it nightly inevitably, or is there a point to where they can reduce the amount that they're using?
No, they have to take it forever.
Okay.
It'd be nice if I knew how to cure people of COPD, but I don't know how. It's lung damage.
Right.
It's analogous. The damage is of the sort that your body would have to grow new lungs to fix.
Yeah.
And it's like if you get your arm cut off. If you got infection in your arm, I can fix an infected arm. If your arm's cut off, I don't know how to grow a new arm. Yeah, if your lungs get an infection, I can fix it. But if your lungs are damaged, then I don't know how to grow new lungs. And it's, doing organ transplants are absolutely problematic. There's organ failure, organ rejection, your immune system's whacked, you have to take all these immune suppressives, and it's really a mess. Nobody wants to do that. And so typically what people do with COPD is they take medications that open their lungs up to get them to work better, what lung they have left, and then they take antibiotics regularly as a way to kind of knock the infections down as they go along. And then they get all kinds of gut problems and so on and so forth. We talk about the weakness that comes from having your bacteria disrupted. If you can avoid doing that, you'll come out of it stronger. So the good news is the COPD patients that I'm treating that are doing this are all prospering. They're all doing fabulous. Now, they still have to be careful what they do. They still have to breathe oxygen. They still have to do a bunch of other kind of stuff. But they're literally glowing, with health. For somebody who's got COPD, they're not declining, and they're actually getting better. So I'm delighted to be able to say that there's this concoction.
Good. Well, what about other bacterial infections, like bacterial skin infections?
Okay, so the herbs are one way to do that, but the thing I like best about doing bacterial infections in the skin is to actually do some kind of local compress. You can do herbs, but you can make them a lot more concentrated, and just make a poultice and just put the poultice on the infection.
Okay.
So what are we talking about, like a boil?
Yeah, or like a hive. Would a hive be an infection?
Hives are not infections.
Okay.
Hives are an immune system reaction.
Okay.
So a boil is an actual infection, where we get a hair follicle gets infected, and then the bacteria kind of drill their way down. And what the body wants to do is to wall it off. So the body will throw extra connective tissue around it, like a wall, and then send white blood cells in to deal with the infection. They're a suicide mission, those white blood cells. And so they go in there, they kill, and they die. They kill, and they die. They kill, and they die. And you get 1 million white blood cells that have all gone in to kill and die, and now you have pus. That's what pus is. It's dead white blood cells that sacrifice themselves for the greater good. And so eventually that pus and bacteria need to get extrude. So that's what a boil is. A boil basically is an infection, it ripens, eventually it pops, and then the gook comes out, and then the body's able to heal it up. So if you can take something to help mature that, and usually a compress is what you do. You do a heated compress, and you put some sort of antibacterial in the heated compress. Again, the ones we mentioned already, any one of them would work. Mahonia is the one I like to use the best. By the way, common name for Mahonia, I forgot to mention, is Oregon grape.
Oregon grape, yep.
So it's an interesting side story of Oregon grape. Why is it called Oregon grape? Because if you ever seen Oregon grape, it doesn't look like grapes at all. It's this kind of spiky-leaved plant, a little bush. The leaves kind of look like holly, except for they're not as thick. And it has this little spray of bitter berries. They're not tasty. They're horrible. If you ever eaten Oregon grape, nobody would eat in the right mind would eat these things. So how could this become so famous? It's a state plant. That's like the revered plant in Oregon. The reason why is real straightforward. Is first of all, it grows everywhere, and then you can take the berries, strip them off, throw them in a bucket or a vat, whatever, a keg, something like that, and they'll ferment.
Oh.
And they'll make booze.
Oh.
And so, for very little money, You can make your own hooch.
Yeah.
And back then, Pioneer days, that's exactly what they did.
That's
they said,
what they did.
I like this plant here. I vote Oregon grape to be our state plant, right?
So with drinking the hooch version, is that also antibacterial?
Yes, it is.
Oh, there you go. 2 for
Absolutely.
1.
You bet. That's actually really good for your blood sugars as well. No, it's an absolute tonic. People feel better for it. They
Good.
come out a stronger version of themselves. Now, why aren't we drinking it now? Because it tastes horrible.
Yeah.
There's always a rub. It kind of goes on. The healthier it is for you, the worse it tastes.
Yeah, there is that. Well, Dr. Luper, we're out of time, but I'm sure we can go into this another episode another time.
Excellent.
Wonderful. Thank you.
Thanks, Haley.
Thanks for tuning in to another episode of Sensible Health Solutions. We hope you found today's discussion enlightening and packed with practical tips to enhance your wellness journey. Remember, small changes can lead to big results. If you enjoyed the episode, don't forget to subscribe and leave us a review on your favorite podcast platform. Your feedback helps us bring you the best content possible. Stay connected with us on social media for more health insights and updates. You can find us at Sensible Health Solutions across all social platforms. Until next time, stay sensible and stay healthy. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Seek medical advice from a healthcare professional for any medical conditions.